Well, also to the media too. Focus Springfield, and to the TV media, and to the print media, and to the radio media. Thank you. You're always here to get our information out, and I appreciate that. And of course, to our residents of the city of Springfield, our business community, your patience, understanding, cooperation, and collaboration has been deeply appreciated. Before I go any further, I'd just like to have a moment of silence. Longtime Springfield Redevelopment Authority board member Bill McGregor, gentleman, very dedicated to the city of Springfield. He served on my SRA board for many, many years. He passed away last week, and never looking for any type of fanfare, but so dedicated to the city and development. So we can just take a moment of silence on behalf of Bill McGregor, and again to his family and friends. My sympathy, thoughts, and prayers and encouragement go out to you. Thank you very much. We'll now go to the stat sheet before I go into a couple of more updates. Total confirmed COVID cases since this ordeal has started, 17,756. Monthly is 2,091. Weekly, and this is a good number. One is too many, but it's a good number, 414. That has gone down. So we're very happy that we're moving in that direction. Unfortunately, there's been 7 more new deaths of Springfield residents that have occurred. And again, my sympathy, thoughts, and prayers and encouragement go out to the families and friends of the affected individuals who passed away. That brings the total of deaths of Springfield residents since this ordeal has started to 218. 92 were white, 47 were black, 72 were Hispanic, 7 were Asian. Commissioner Helen Carlton Harris will speak a little more specifically on 7 that have passed. Of that, 42.2% encompass white, 21.5% encompass black, 33% encompassed Hispanic, and 3.2% encompass Asian. The trend continues to be on residential side. Those 7 were residential, 159 total now for 73%. Long-term care facilities pretty much stayed status quo for quite a while, 59 at 27%. Commissioner Carlton Harris will speak to you more about the Vax Force. The town hall meeting will be held March 16th, and I believe it's going to be in the evening, 6 to 8 p.m. And again, that is to have the individuals, it's a very diverse group of medical professional, advocates, neighborhood leaders, to dispel any misinformation out about not taking the vaccine, and that it's safe and sound and good for them and their families. So the town hall meeting of the Vax Force, Commissioner Carlton Harris and I, and the Vax Force will be March 16th from 6 to 8 p.m. We continue the Stop the Spread testing with AMR and Patrick Leonardo, Director of Operations at the Eastfield Mall. Commissioner Carlton Harris, again, going to the old Doobie Brothers song, taking it to the streets, continues her neighborhood testing. She worked with State Representative Bud Williams, Rebecca Johnson, Putnam, and Kennedy Middle School. Helen and I have been on the phones or phone calls back and forth over the weekend and late Thursday and Friday. We continue to advocate for the neighborhood vaccines, and again, we're working with the governor, lieutenant governor, Dr. Kerouac at Bay State, AMR, B&H has reached out, also Curative also, and we are, and State Health Commissioner Monica Burrell over the weekend too, and conversations with State Representative Carlos Gonzalez, who happens to be the chair, new chair of Public Safety. on two things. Helen and I, we've had a plan we put across to State Health Commissioner Monica Burrell to 5 locations right now to do more of a intimate type vaccines to black and brown populations, or those populations that are having difficulties getting their vaccine, and we want to take it to the streets. And we're also discussing a possibility of mobile type units too. So stay tuned on that, more to come, but we seem to have gotten the state's attention and curative's attention too. So let's see what can come forth. But I and Commissioner Carlton Harris will continue to be diplomatically aggressive in twisting arms to make sure that we get the vaccine for our Springfield residents. So stay tuned on that. The mass vaccination site at the Eastfield Mall continues to operate much smoothly now, and we get those calls of thanks. Many people indicating that sometimes their whole time up there is 20 to 25 minutes, including their stay after the shop. I also want to thank Commissioner Carlton Harris, the Library Molly Fogarty, Elder Affairs Sandy Federico, Sheriff Nick Cochi, and the state's 211. The phone lines we have, phone banks to help out, especially seniors having troubles signing up for the vaccines. We've gotten a number of phone calls, emails. They're very thankful, and they're very appreciative of the help that we've directly given to them. Governor Baker has again announced reopening. We're now in phase 3. Step 2, really some of the businesses can now be open 50% capacity. March 22nd is the phase 4. The restaurant capacities, and again, Commissioner Carlton Harris and Chief Development Officer Tim Sheehan will speak more about it, are at full capacity but still have to follow the public health guidelines. I understand right now we're still 25 outside if you're home, or 10 inside. They'll get more specific on that. Before I go any further, tomorrow is Dr. Seuss's, Theodore Geisel's, 117th birthday. And you know, he's another Springfield first and favorite. So we wanted to wish all the fans of Dr. Seuss, his family, happy birthday. And why not come out to the one and only in the world Dr. Seuss Museum right here in Springfield, Massachusetts. And as one of my favorites about redfish, one fish, two fish, red fish, bluefish, I understand that Dr. Seuss in the 1920s went to Dartmouth College, and he was voted the least likely to succeed. I'd say he got the last laugh on that. And speaking of another Springfield first, and I want to thank the Republican for their editorial, George R. Waddy and Cynthia Simonson, pertaining to an individual's comments. I took some time to look in Merriam-Webster, which is another dictionary, which is a company which is another first in Springfield's history, and I looked under the definition of Tucker Carlson. And you know what it said? It said disingenuous, pompous ass for the comments that he made to disparage the city of Springfield and the great residents of all creed colors and backgrounds in the business community. Non sequitur, the story he had. No connection to the story of what occurred at Northampton and Smith College. And that was a cheap shot. But then again, when you have a silver spoon in your mouth, you don't realize what it takes and how hard our people work and where they've come from and where they're going. So again, another Springfield first for you, Tucker. Definition of you: disingenuous, pompous ass. I want to thank Congressman, that's not a good segue, but I want to thank Congressman Neil Ritchie. Again, he's been on the forefront not only for the city of Springfield, his district, Commonwealth of Massachusetts, but the nation in leading the relief package, COVID-19 relief package and recovery, which I'm very hopeful the Senate will take up as soon as possible. That'll be very beneficial to our residents and business community here in the city, and also to the city of Springfield. So to Congressman Neil Ritchie, thank you. We always know that we can count on you. This Saturday afternoon, it was cold and rainy and raw, but we still had the Dominican flag raising at City Hall, and that was a nice event. I was joined by my colleagues in government, State Representative Carlos Gonzalez and State Senator Adam Gomez, and our own engineer, Chris Vladimir Kakaris, who's part of that Dominican Sports Club on that, so that went very, very well. This Wednesday, we spoke about Dr. Seuss, the literacy, early literacy leadership forum seminar goes on, sort of virtual, and I want to thank Library Deputy Director Jean Canoz-Albano and Chrissy Howard, taped in the Davis Foundation. We do that now for our kids now. If you can't read, you can't succeed. So we've been very aggressive with Superintendent Warwick, and videotaped readings will occur, I believe it's this Wednesday. I want to thank another great corporate citizen for, I believe, 168 years. Mass Mutual Life Insurance Company, Roger Crandall, again stepping to the plate. $50 million going to go to our businesses. 25 of that will be going directly, and this is outside of Boston. I mean, this 25 million will be going directly to black businesses, and 25 million will be going to technical tech businesses on that. I had a update call with his leading executives last week to give them an update on our COVID-19. They want to know what they can do to help us, everything that we're doing, and also gave an update on the continued police initiatives and police reform Commissioner Clapper is doing with my Chief of Staff, Tom Ash, and I. The weather is getting warmer, which is good, but two negative activities are going to peek their ugly heads again. The marauders, the illegal dirt bikes, those kids or young people on bikes going up and down our streets in not the proper fashion, where they could get hurt, or the individual pedestrian, especially the vehicular traffic, can get hurt or injured. So two things here. I've already spoken to Commissioner Clapper, and we spoke over the weekend. I have before the City Council home rule legislation, and there's an ordinance to help out our police department. This home rule legislation on fireworks, and Councilor Victor Davila said he was going to bring it out of committee. He has not done it at this point in time. I don't know when the hell he's going to do it. Would ask him to do it. And we have ordinance on dirt bikes, illegal dirt bikes. I need the City Council to act. These things have lied dormant for a month, if not a year. This can help our police department and Commissioner Clapper to try to curtail these illegal dirt bike activities and these bicycle riders who do not want to be respectful to the vehicular and pedestrian traffic. In turn, I spoke with Commissioner Clapper with our great partnership with the state police. We'll incorporate the state police and get them pulled over on Chapter 90 violations. But the weather is getting warmer. I already witnessed it last Friday evening, myself personally on it. So dirt bikes are illegal. Many of them are stolen. And officers have to be careful how they pursue that. But we want them reported. On the bicyclist, and not all the kids are bad kids. Sometimes talk to decent kids, but you always have one or two that literally want to drive into your car, which not only puts them in harm's way, but puts the person in the vehicle in harm's way. Very traumatic. So, please, to the City Council, you have this legislation, home rule legislation, which puts some teeth in the fireworks to stop the illegal fireworks and the torture we went through last year. And there's an ordinance that puts more teeth on the illegal dirt bikes. I need the City Council to act on these ASAP. We don't want to go through another warmer months or summer period not having these teeth. It's been before you for months. It's advantageous not only to myself and you, but to our Springfield residents and business community. I need you to act. This week just started National Consumer Protection Week. I want to give a shout out to my director of the Mayor's Office of Consumer Affairs, Millie Johnson, who does a great job. And we work very closely with Attorney General Maura Healey to protect our residents and business community on consumer protection. So that's all this week. I went by Friday, and that's why this federal package is so needed. Oasis Food Bank at Central High School, John Foley, Food Bank of Western Massachusetts, Sedesco, City Team. I think it must have been about 10:30 in the morning. That whole Schmid Arena parking lot, packed. Central High parking lot, packed. Some cars out on Roosevelt Avenue. These are families who thought they never would need any help, that we continue to feed about 3,500 families every week. Just to let people know that. So I'm glad the House, Congress has acted. We need Senate to act as soon as possible. And then finally, before the cabinet head updates, been a wonderful call. The Chief of Staff and Bishop Bill Byrne reached out to me, and he's hit the ground running. It's been tremendous. He likes to walk his dog, Zelly, in Forest Park, as you know, Commissioner Clapper. And he came up, this is his idea, and I love it. So stay tuned, and we'll work with Pat Sullivan. But he wants to offer an outdoor mass at our beautiful Forest Park, maybe at the amphitheater, when it's appropriate, about pertaining to COVID-19. And this would be a mass of remembrance, healing, recovery, and rebirth. And again, that comes from our newly minted Bishop Bill Byrne, and I'm looking forward to that. I think that's such a heartwarming gesture, so we look forward to doing that. Okay, quickly on the police side, Commissioner Clapper indicates that we are only down 1 in COVID, which is very good. She'll speak to you on the license to carry. Applications in public aspects are opening up again. We continue with our Department of Justice meetings. We had another one last week. We unfortunately had a murder, and my thoughts and prayers go out to the family members. I've sent them a letter. Strong leads there. I feel very confident that we'll be able to bring justice to that family, and I thank our Commissioner Clapper and our men and women in blue. They made a couple of arrests this weekend. It was quiet on convenience store robbery. They made arrests on that. The combined fire and police dispatch, and again, the Commissioner Calvi, Deputy Wells, fantastic job. Fantastic job. And that's front line for our residents, business community. Ruben Barrero is going to be retiring. I think Commissioner Clapper would indicate to me about 46 years. He was the first Hispanic police officer, longest serving Hispanic police officer ever in the city's Springfield history. Ruben, gracias, thank you. Interesting note that Commissioner Clapper brought to me about a police academy or recruits. Normally when these academies are announced, they're knocking down the door to apply. 300 to 500 applicants. Because of the atmosphere that we are in now, there is 30, maybe 50 applicants. looking to become police officers. We need to be cognizant of that. Commissioner Calvi's only down one in COVID. Again, fantastic job he did, really spearheading the Combined Dispatch Center. He'll speak to you, as Pat Sullivan will, ICE safety, just to put in people's minds. Some people still want to venture out there. I know last week we said we're going to do a Lenny, we always traditionally do the Lenny Corbin Memorial event at the end of Black History Month. Lenny's brother Eddie reached out because of the COVID-19, and the family, they wanted to wait a little longer. So as soon as Eddie Corbin gives us the okay, we'll be proudly doing the Lenny Corbin Memorial event in Mason Square Fire Station, to be announced. DPW Director Chris Signoli indicates he's down one with COVID. We are now in pothole season, and so we, again, 311 or call. Chris will have, Director Signoli will have units out there filling potholes that we need to know about. Superintendent Dan Warwick indicates to me meals. We have served our students and families since the start of this ordeal, 6,356,264. Over the weekend, 88,052 meals went out to our students and families of the Springfield Public School System. Again, that's breakfast, lunch, dinner, and snacks. The school retrofits continue to go very well, and Pat Sullivan and crew have done a tremendous job. Superintendent Warwick will speak to you more specifically on the hybrid opening and the orders that have come down from Education Commissioner Riley from the state. Again, this is all subject to negotiations with teachers and other respective unions of the Springfield Public School System. But we do have a plan. We announced that plan last week. Finance, my CAFO TJ plan indicates to me since this has started, deficit down 7.7 million. I'm down about 2.8 million for FY21. Deficit in grants, again, I'll do everything I can, get my hands on every dime I can for the residents, business community, city of Springfield, as we've done with all the natural man-made disasters. $32.5 million. Deficit spent in grants. Of that, I've been able to offset or pawn $24.2 million to grants. Still deficit spending of $8.3 million. We continue our budget development for FY22. And again, I want to thank TJ, the $900,000 we were able to cobble together for the Combined Dispatch Center, state-of-the-art, and just a wonderful job that was done there. Facilities and parks, Pat Sullivan indicates to me he's down one with COVID. He'll speak to you. High wind warning is going into effect today and tonight, and precautions you should take there. He and his team have done an outstanding job, again, retrofitting our schools, ventilation-wise, in our public buildings. He's prepping now for summer programs he'll speak to you about, and the carriage house reopening. He'll touch base on ICE safety. We had a wonderful event Friday morning, being able to thank all the facilities people, frontline people that are at all our public buildings to allow our public to come in. They take the temperature, they direct them where they should go. They're there to help them, and we just wanted to say thank you to them, because many times it can be a little confusing for individuals coming in, and they have been there to shepherd our constituents and where they need to go and help them out. So again, to all the facilities guys and young ladies, tremendous job, and thank you again. You might see that there's a tent going up back in the horseshoe area of City Hall. Again, we're looking to be innovative in another initiative, and working with Patrick Sullivan and our treasurer, Christopher Caputo. This is the time of year when lines start to form at City Hall. Many times this time of year you'll see lines wrapped around the hallways in City Hall. For protection and preservation not only of our workforce but for the residents of the city of Springfield, we have temporarily put 3 pay windows outside exterior in the horseshoe, where you can walk right up We have a tenting facility going up there in case it's inclement weather, and we'll have heaters there for the convenience of our constituents, the residents, city of Springfield business community. So you'll be able to pay some bills temporarily right outside there at those 3 windows. So again, the Pat Sullivan and crew, I'm very appreciative, and to Treasurer Chris Caputo and his staff, thank you. But we're trying to go above and beyond convenience of our constituents and for public health and safety, so those massive lines do not wrap around inside here at City Hall. Echo Dev, Chief Development Officer Tim Sheen, he's down 2 with COVID. He will speak to you more about the relief packages coming from the federal side and the state. He'll speak to you about Mass Mutual. He'll also speak to you about Governor Baker's reopening plan. He'll also have some interesting and disturbing facts pertaining to how hard the women of the community, of the state, and the country have been hit when it comes to this COVID-19, especially with their businesses. Law, HR, and Labor. Law Department is down 1 with COVID. Solicitor Pakula indicates to me we continue our Department of Justice meetings on police initiatives and reforms, and hopeful coming to a mutual agreement in the very near future. And HR Director and Labor Director Attorney Bill Mahoney indicates to me, and I'm very thankful, we worked with the City Council. The military leave ordinance, signed off on that, and that supports our military personnel, our city employees, police and fire, others that are away protecting our country. So we're very proud that we were able to do that. So there's a lot of updates today. We are moving in the right direction, and that's important. What we've been able to do, especially with the cooperation, collaboration, and luckily having 2 world-class hospitals here, Bay State and Mercy Hospital. So without further ado, and after these 2 individuals, professionals speak, we'll take questions as usual so they can move back to their respected establishments. Without further ado, the President and CEO of Bay State Health Systems, Dr. Mark Kerouac. Thank you.
Good morning, everybody, and thank you, Mr. Mayor, again, for the opportunity and for your cooperation. I wanted to take a moment to acknowledge that Bay State Health this week will be celebrating an Employee Appreciation Week. This involves our 12,000 team members across the system who've shown this last year tremendous courage, sacrifice, and innovation. I salute their steadfast commitment to the highest standards. Thank you. So we'll be doing a number of things to celebrate them this week, and I'm very, very proud of what they've been able to accomplish. The rate of new COVID-19 cases has continued to decline across the country and across the state. Daily new cases in the United States continue below 100,000. Yesterday they were 68,000. There was some increase for a few days last week, likely related to colleges and universities attempting to reopen. There was no increase in hospitalizations around that time. Also of note, nursing homes, deaths in nursing homes have declined dramatically in the last couple of months, nursing home residents having been a major target of our vaccine initiatives. In Massachusetts, new cases continue to decline, 1,428 yesterday, 52 deaths. Test positivity rates are below 2%, which is a very low rate. You'll notice that the map of the state has far less red and a lot more yellow in terms of the towns and cities that are all experiencing lower rates. All of the counties in Massachusetts have had falling rates of new cases, but Hampshire County came in as a surprise #1 county in the state. So everyone's going down, but Hampshire and Hampden counties less quickly than the others. This is due to an outbreak related to UMass, and Amherst did flip into the red zone as a result of outbreaks amongst students with off-campus gatherings, as I understand it. Camden County is slightly behind Hampshire County, and at number 2, Springfield and Chicopee remain in the red, and I'm sure Commissioner Carlton Harris will have more to say about that. And so even though things are heading down, this neck of the woods is heading down a little more slowly than the rest of the state. Bay State Health continues its slow decline in cases as well. Today we have 78 in the system, 72 at our Springfield campus, 6 in our community campuses, and 7 in critical care. Our test positivity rate of 3.02% is the lowest since November. Now I want to bring you the news from Great Britain, which I know you're all anxious to hear. Yesterday in Great Britain, there were 7,400 new cases of COVID-19 and 291 deaths. That's 10 times fewer cases than there were 2 months ago, and 6 times fewer deaths compared to 2 months ago. So why am I bothering you with this? Remember, Great Britain is the country where the supposedly more contagious British variant was predominating. In spite of that, they've had a dramatic drop in cases by vaccinating and by following public health methods. And I think that it's important for those of you who are consuming the news on COVID to keep an eye on what's really happening. Remember, when this variant came out, a lot of people, including a lot of physicians, got on TV and talked about what might happen and what they were worried about. I think it's important for us to focus on what is happening rather than theoretically what might be happening based on laboratory testing, et cetera. Not to say I would never worry about the possibility of variants, but what I'd like to see before I started worrying would be variants that are breaking through known effective approaches, such as infecting people who have already been vaccinated or infecting groups that are following the proper precautions. Getting on to vaccination now. The big news of the weekend, of course, was the release by the FDA, emergency use authorization of the Jansen vaccine. This vaccine was tested later on, time-wise, than the mRNA vaccines we have now in place. And as luck would have it, they decided to test in a couple of areas where these variants were quite common, Brazil and South Africa. Overall, though, in spite of this, the protection against any infection was 66%. The protection against infection in the United States was 72%. It achieved 85% protection against serious disease and 100% protection against hospitalization and death, which is the really important thing. The other important aspects of this vaccine is it can be stored under a refrigerator or for months in a normal freezer. It is also a one-shot vaccine, so you don't have to follow the patient or find them again. Because of its stability and the single-dose administration, this may favor either smaller sites like offices or small clinics, or more remote locations, rural locations, or people who are homebound. So it gives us a lot more options. There will not be a ton of vaccine available immediately, but they do say there'll be another 20 million doses of J&J out this month and up to 100 million in the next several months. I believe that it's likely by May that we will not be facing supply shortages and will worry instead about people who are hesitant to get the vaccine. Remember now, we are vaccinating anyone who is over the age of 65 and who has 2 or more of those chronic conditions we've talked about, like diabetes, high blood pressure, obesity, et cetera, or who is a resident of public or subsidized senior housing. The message to the general public is that you should get any of the 3 vaccines. They're all extremely effective and safe as soon as you're eligible. This is really the key to our getting this virus behind us. So the United States has given out to the states 75 million vaccines, and over 50 million people have received at least 1 dose. We also have now many months of safety data. So to people who are waiting, I would have to say, with 50 million having gotten the vaccine, what are you waiting for? There are no new types of side effects that have come up in spite of the administration to millions and millions of people. Massachusetts has administered 1.7 million shots, 1.2 million via the state program, and 500,000 via the federal program for nursing homes. About 87% of the 2 million doses have been allocated, have been administered that have been allocated to the state. Last week, unfortunately, there were weather delays in other parts of the country that delayed the delivery of vaccine, and it kept the rates of vaccine administration on the low-ish side. The 7-day average was 30,000 shots a day, and in the state, we've gotten up over 50,000 on many days. Remember, what we're really shooting for is 40,000 first doses and 40,000 second doses every day if we're going to hit the goal by the summer. Obviously, you don't need the second dose for the Johnson & Johnson shot. Bay State Health has administered 38,864 shots to date. We're now receiving an allotment of 2,400 doses of vaccine every week, both Moderna and Pfizer. And we're very pleased that the state has maintained its confidence in our efforts, and they have affirmed and committed vaccine to us for the next 4 to 6 weeks. We currently average about 800 to 900 shots a day. We apportion part of our supply to Franklin County, which is very far away from the mass vac sites, and to our 3 health centers here in Springfield. We reach out and contact high-risk patients directly to help them with the appointment process. And we're pleased that we can offer the vaccines at the 3 health centers because this is where our most vulnerable patients are getting their care. Vaccine appointments can be made at mass.gov, and when you click there, you'll find the map, and if you click on the Bay State location, it will tell you if we're accepting appointments or not. As you know, demand is still exceeding supply. The mayor and I, Representative Bud Williams, Representative Carlos Gonzalez, have all been advocating for additional public sites here in Springfield, and we've all endorsed to both the governor and Secretary Sutters the plan laid out by Commissioner Carlton Harris. I'd also like to see a site west of the river, and we've seen sites, consortiums of public health organizations come together in both Hampshire and Franklin counties, which takes the pressure off up there. But we still have work to do west of the river and in downtown Springfield. Across the Pioneer Valley, the combined vaccine sites, remember about 10% of the state population here, need to do 4,000 first doses and 4,000 second doses every day if we're going to get the job done by June. Between the Mall and Bay State, Mercy, the consortiums in Hampshire and Franklin counties, if we add in a site on the west side and the additional sites in Springfield, I'm confident that we can get there and get the job done. As supplies become more and more available, their efforts to will increase to persuade people who are hesitant to get the shot. There is a lot of misinformation out there, directed often at communities of color from people who are dyed-in-the-wool anti-vaccine advocates. So it really needs to be countered aggressively. There's excellent work that's being done statewide by the Mass Hospital Association and the Department of Public Health to develop materials, including TV spots and communications kits. Bay State Health has been a part of those efforts. And here in Springfield by Commissioner Carlton Harris and her VAX force, and we're pleased to have a number of individuals taking part in that as well. We also have information for pregnant women on our website. If you search COVID-19 and pregnancy at baystatehealth.org, you'll find a decision aid which has been used actually across the country. Mass General, Boston Medical Center, even Kaiser in Southern California has started to use this tool. There have been over 10,000 pregnant women have gotten the shot safely, including some Bay State doctors who were the authors of this. COVID-19 in pregnancy can cause severe pneumonia and premature delivery, so people really need to think clearly about that decision. Accepting vaccine is an issue of trust. We understand that, and we need to make sure that the right messages from the right people are being heard in all the neighborhoods and all the communities we serve. Bay State has teams dedicated to outreach and education, and through our work and the collaborative partnerships with others, we're supporting people who may feel hesitant. Remember that all of these vaccines have undergone extensive testing in tens of thousands of individuals from all backgrounds. They were determined to be safe and effective by independent panels of vaccine experts, Over 50 million Americans have gotten the shot. You can't get COVID from the shot, but you can get COVID by putting it off. I believe that getting vaccinated is safe and vitally important to fight the virus. We are bringing trusted sources to the communities we serve, recognize the importance of connecting to the people that need to make this decision. Finally, until you're eligible for vaccine, remember there's a lot of virus around, even though the numbers are declining. I'm going to give you one more international example that we can learn a lot from, and it's from the country of Israel, which is the global leader in vaccinating its population. They vaccinated 50% of their citizens as a result of a highly organized health system that we can only envy here in the United States. In spite of that, the numbers of cases are increasing in the country. The politicians are blaming the variant virus, but given what I've said about Great Britain, we all know that that's a little bit shaky. What's really happening is that many ethnic groups, Orthodox Jews, are openly defying the public health guidance around masking and social distancing. And many young people have taken the good news about vaccination as a signal that it's party on time, that they can basically give up all of the various kinds of things. So that even in a country that's achieved high rates of vaccination, if you give up on the public health measures, you can get yourself into trouble. And that's something for us to keep in mind as we are trying now to relax some of the measures here in the city. Even though we're doing a pretty good job at vaccination, we still need to realize that these are baby steps and that we need to continue to follow the rules. The keys to defeating this virus, and the only things I watch, I have to say, number one, it's the velocity of vaccine administration, and number two, the continued adherence to public health measures. So I'll stop there, Mr. Mayor, and I thank you for your time, and I guess we'll pass it over to Dr. Bruce.
Thank you, Dr. Carrick, very much. And now the Chief Medical Officer of Mercy Hospital, Trinity Healthcare, Dr. Robert Lewis.
Thank you, Mayor. And thanks for continuing to provide leadership amidst the pandemic here in the city of Springfield and beyond in Western Massachusetts. And I hope everybody did have a nice weekend and good morning. It has been a pretty wet one over the last couple of days, but as the mayor said earlier, with the weather starting to warm, it's a good sign that spring is coming. There's also been plenty of good news in the form of the pandemic lately, with declining rates of infections and hospitalizations, and the authorization of now a third safe and effective vaccine. I will, however, just temper that a little bit. We are approaching a year since the public health emergency was declared here in the Commonwealth of Massachusetts, and we would have seen the first death in the Commonwealth due to COVID in just a couple of weeks from now. And I share a little bit of caution regarding some of the numbers, because in fact, last week was the first week in the past couple of months where we did not see a decrease in the 7-day average of new infections per day across the country. The total number of confirmed infections across the country is over 28.6 million, over 512,000 deaths to date, and 50,000 people are still hospitalized across the country. When we look at the last 2 weeks, the 7-day average number of new infections per day did drop by about 30%, but when we look at just the last 7 days, that has actually slowed to a standstill. It did not change at all, in fact. It remained about 68,000 per day, which to me is something to be mindful of and something of some concern. It reinforces the fact that we must continue to be cautious, as was mentioned. There are also some neighboring nearby states that are some of the states that are driving this trend, that have had their numbers of new infections per day stop declining, including New York and New Jersey. Here in Massachusetts, our trends have stayed a little bit brighter than some of our neighboring states. They're not dropping quite as steeply as they were before, but they have continued to go down. But we must remember that we often have followed here in Western Massachusetts the trends that have come out of the states around us, like New York. Over the past 2 weeks here, the decline of the 7-day average of new infections per day dropped by about 30%, down to 1,200 per day. But the decline over the last week was just 16%. Hospitalized cases has followed a similar trend, also dropping by 35% over the past 2 weeks, but only 19% in the last week. So the trends are positive, but they do seem to be slowing ever so slightly. So we must continue to be vigilant and stay safe and practice the public health guidelines. At Mercy Medical Center, you might recall that last week we had actually seen a spike of hospitalized cases. At the beginning of last week, we went to over 30 hospitalized patients on Monday. Fortunately, since then, we have seen a decrease, and we continued to discharge patients to home, and we had fewer COVID-related admissions. And so as of this morning, we have just 19 patients hospitalized with COVID, of which 4 are in the ICU. Even with the positive trends compared to where we were a couple of months ago, we're still only where we were around Thanksgiving. So from the country's perspective, there's just reason to still be cautious. We're definitely faring better, but the downward trend has slowed, and we are still some time away from herd immunity. So the focus must continue on being safe, staying vigilant, and then escalating this vaccine campaign as quickly as possible. As announced by Governor Baker last week, we are moving into step 2 of phase 3 of the Commonwealth's reopening plan, which does apply to all cities and towns, even those that remain in the red, so to speak. It changes some of the capacity limits in certain types of indoor performance and recreational activities. And I personally think it is a fine decision to take this step forward at this time. We have seen the trends move in the right direction, and we are continuing to follow the data and the science, which has been a strength of the approach here in Massachusetts. But it is worth reminding us that all of the activities and interactions with people outside of our households are still to be done with following the precautions of wearing masks, practicing physical distancing, and limiting gatherings and travel to those hotspots. I want to remind us that we actually were in this step of phase 3 before, in the fall, and we had to roll back into step 1 because of the rising rates. We don't want to get to that point again. We want to continue to move forward and get to phase 4 in another month or so. The pathway there will be following the recommendations and vaccination, as was mentioned. On the vaccination front, according to the CDC, 75 million vaccines have been administered. 25 million people have received the full series. That's 20% of the adult population having received at least 1 dose, which we know will confer some protection, and about 10% have received now a full series. Here in Massachusetts, we've now administered over 1.7 million doses, which represents about 85% of all the doses shipped to the state, and over 500,000 people are now fully vaccinated after receiving both their doses, which represents about 10% of our adult population as well, so mirroring the national rate. It was mentioned, the big important news on Saturday was that the FDA did grant emergency use authorization of the Johnson & Johnson, or what's called the Jansen Vaccine, as a subsidiary of Johnson & Johnson that's produced the vaccine. This was expected. It was expected because the data from the trials had already then been released, and it received a recommendation from the advisory committee. It's a notable decision. This is now the 3rd safe and effective vaccine that we have available to prevent COVID. And as we know, the most critical factor in determining when we will reach herd immunity is the rate in which we can continue to vaccinate the population here in the United States, but also across the entire globe. The Jansen vaccine is reportedly able to get about 20 million doses out across the country here by the end of March, starting as early as this coming week, and 100 million doses by the end of June, which would significantly bolster our efforts. There are some differences, which you're likely aware of and were talked about. It's authorized with a single-dose regimen, does not require additional or unusual special ultra-cold refrigeration. There has been a lot of talk about the efficacy, and I just want to reinforce as well the significant high efficacy of 85% in preventing serious illness related to the coronavirus, and the fact that it was tested in multiple countries across the globe, including here in the United States, Brazil, and South Africa. The takeaway is that we have another safe and effective vaccine. It's not yet clear how it will be allocated or distributed as part of a federal or a statewide program. It's possible that because it's a single shot and it doesn't have special storage requirements, that it could provide access to communities where follow-up or the storage requirements may have presented challenges with the other vaccines. But irrespective of that, the key is that we get more vaccine out into the arms of people across the country and the globe as fast as possible. So if you Jansen vaccine in the coming weeks, you should sign up to get it without hesitation, just as I would. At Mercy Medical Center, we continue to vaccinate as many people as we can with the supply that we are allocated. We have not been told yet if we will receive the Johnson & Johnson or Jansen vaccine, but we will be ready to incorporate it if we do. As of today, we've provided over 8,500 vaccines and more than 3,500 people have been fully vaccinated in our clinic. And we will continue to advocate and push the state to allocate more vaccine here in our local community, in Western Massachusetts and in Hampden County in particular. As of last week's Department of Public Health's weekly vaccine report, only 13.3% of Hampden County residents had received one dose, and only 5.1% had received both doses. Both of those percentages are below the state average. And we continue to have two cities in Springfield and Holyoke that have been two of the hardest hit by COVID and remain in the red with new infections per population. I personally believe that we must continue to push to ensure that the vaccines are distributed equitably and we prioritize the communities that are suffering disproportionate impact from the disease. In terms of signing up for appointments, we certainly know that appointments are hard to obtain in general and throughout the community and state. If you have an appointment with us at Mercy Medical Center, please do be reassured that you will receive your vaccine as scheduled and on time. We are continuing to receive shipments from the Department of Public Health at about 1,100 per week. We do book up our slots just as quickly as every other site, however, so you must check back at the website and go through the centralized process as best as you can to locate those available appointments. That will be our pathway forward. For now, just be reinforced to stay safe, be vigilant, sign up for a vaccine as soon as you're eligible, and if we do this together, I'm sure we will emerge over the coming months. Thank you.
Thank you, Dr. Russo. We'll now take questions for Dr. Kerouac and Dr. Russo. Dr. Russo, 40, Eric, 22, Paul, Matt. So any questions, comments you might have? Audrey?
I was wondering, will people be able to request a certain vaccine if you guys are getting Johnson & Johnson vaccine together? Will people be able to say, I want this or that?
We're not expecting that. We've actually requested that, the question was, would people be able to request which brand of vaccine they get? We've asked the state to really try to keep it simple and allow us to have one brand of vaccine. And I suspect most clinics will try to do that as well. And I think that there is, I wouldn't want to give the message that there are material differences in terms of the protectiveness of any of them, in addition to which their side effect profiles are quite similar.
I want to echo that as well. We have had times where we would be administering Pfizer or Moderna, but we would give folks the vaccine that we have available at that time to those individuals. Right now, we would concur with Dr. Kerouac's approach. It's much more simple logistically if sites are able to focus on one and not have a multitude of vaccines. And really the approach is that all three are safe and effective, and we encourage the use of whichever one's available to you.
Audrey?
And just as a follow-up, Dr. I think I heard you say this, but I just want to double check to make sure. You guys said you haven't been given any sort of guidance report as to whether or not you get Johnson & Johnson?
At this point, we have not received any information or guidance on how the state will choose to allocate or distribute the Johnson & Johnson vaccine. I would expect once they've made that determination, they will communicate that out to everybody, but we have not heard that.
Dr. Zussman, I think you wanted to comment at all on CDC Director Dr. Lindsay talking about how she was concerned about the cases were going up nationally a bit last week, and also warning about reopening at all. Have any thoughts on what she said?
I'll just comment because I, included something in my remarks that over the last 7 days, when looking at the new infections per day, they have stalled. So across the country, they've remained the same. They've been about 68,000 per day over the course of the past 7 days. When we look back at the last 14 days, there was a drop from about 95 or 100,000 to 68,000. So there was about a 30% drop, but it did stall. And there are some states where the declines have not continued over the last 7 days. There may be some reasons for that, which could include how testing is being accomplished, when people tested themselves over the last 2 weeks and so forth. But generally speaking, to me, it's just a reason for continued caution and continue to reinforce the public health measures that we know are effective against preventing the spread. In regards to reopening, I believe, looking at the data here in Massachusetts, that it does make sense to take this step today, but it does require that people continue to wear masks, practice physical distancing, and monitor their behavior, just as we have all along the way. We want to not have to roll back. We want to be able to move forward a month from now into phase 4, and that will be dependent upon the behaviors that we do, as well as how quickly we can escalate the vaccines.
Nothing to add to that.
And this is the kind of follow-up to that, Dr. Galloway, the former FDA commissioner, I believe, made a comment, I don't know if it was on Twitter or one of the shows, but the profile of who's at risk is changing as a result of the vaccination regimen. Can you speak at all to how, when you start changing who is most at risk for death and hospitalization, how that also affects our outlook on meeting access as far as the health measures are?
Well, the profile of who's getting the new infections clearly has been affected by the vaccine effectiveness. The number of folks in nursing home has come crashing down to a fraction of what it was, and the new cases, the age groups predominating are the people in their 20s and 30s. And my concern is that they may be deciding in some way that it's okay to relax some of the public health measures. There still is a minority of people who get the infection in those young age groups who might get these serious effects like the loss of smell, blood clots, multiple organ failure, as well as the so-called long hauler problem where you have persisting symptoms for months and months. I mean, we've opened up now a specialized clinic for these individuals. So it is better not to take that chance, even though the chances are relatively lower for younger people. And I do believe that the behaviors of people are the things that are determining the spectrum of cases we're seeing in the age groups.
Nothing to add. Thank you.
Audrey?
Because both of you guys did mention vaccine hesitancy, I know anecdotally I've heard a couple of people who have said to me, I don't want to get the Johnson vaccine. I'm concerned about how it's different from the RNA vaccines before by Pfizer and Moderna. Anything to add just on differences between the Johnson vaccine and the other two?
Well, I think the thing that people really care about is, am I going to get really sick, hospitalized, or killed by getting COVID? And the Johnson & Johnson vaccine has excellent statistics there. I mean, 85 to 100% protection rate against those. And in a sense, it's almost as if the best flu shot you've ever thought of had come out on the market. One dose. It doesn't completely protect against mild infection, but it will keep you from getting killed by the virus or being hospitalized by it. I think that's a pretty good deal. And so I could envision this virus being used for broadly distributed administration in small clinics and offices, or even mobile distribution. And possibly it'll have a niche among the people who really don't want to get a second shot. We are noticing in some quarters, people will go ahead and get the first shot of Moderna or Pfizer and not come back for the second one because they got a side effect, and that kind of defeats the purpose.
Dr. Kira, could you just indicate on just a regular flu shot, the proficiency of a regular flu shot's always been much, much lower?
Yeah, it's 50% is an average year, 60, 70% is a really good year, but that's against any kind of infection. And so people who get the flu shot and get a little mild flu may sometimes want to get their money back or feel that they didn't luck out or whatever. But the protection against hospitalization or death is 95%. So it's very much similar to the Johnson & Johnson story.
Thank you for clarifying.
I don't have anything else to add to that.
To follow up on that point, there are multiple manufacturers each season of flu vaccine.
Yes.
And nobody goes around picking which vaccine they get, right?
That's correct.
It doesn't make any difference.
3 or 4 at least most years.
Yeah.
Any other questions or comments? Okay, hearing none, Dr. Carroll.
Thank you.
Dr.
Thank you.
Lewis, thank you to you and your staffs and families, and stay healthy. And thanks for everything. Okay, we'll now get the update, city side, from the Commissioner of Health and Human Services, Helen Carlton-Harris.
Thank you, Mayor, for your support and your leadership, as always. The City of Springfield, the Mayor has told you, is reporting 17,756 cases. In terms of the data, I will start with the cases. And so we had Sunday, 53 cases, Monday, 60, Tuesday, 27, Wednesday, 99, Thursday, 55, Friday, 61, and Saturday, 59. The ages, there were 44 in the 0 to 10-year age category, which is 10.6 of the cases, 84 in the 11 to 20 category, which was 20.3% of the cases, 68 in 21 to 30, which is 16.4% of the cases, 60 in 31 to 40, which is 14.5% of the cases, 49 in 41 to 50, which is 11.9% of the cases, and 51 in the 51 to 60-year-old category, which is 12.3% of the cases, 32 in the 61 to 70 age category, 7.7% of the cases, and in the 71 to 80 category, there were 18, which is 4.3% of the cases, and 8 in the 81 to 90-year-old category, which was 1.9% of our cases. In the ages of our cases right now, we continue to see the under 30 population had 48% of our cases, 31 to 50, 26% of our cases, and 51 and older was 26% of our cases. Again, under 50 continues to be the age group where we're seeing the most prevalence of the virus. That is 74% of the cases. When we look at the data over time, I'm looking at 8 weeks worth of data actually to show you where we are as far as cases are concerned. You will recall that on January 3rd, we had 1,177 cases. That next week, we had 1,043 cases. We decreased by 134 cases. That next week, we had 952 cases. We decreased by 91 cases. January 24th, we had 911 cases. We decreased by 41 cases. January 31st, 638 cases. We went down by 273 cases. February 7th, 531 cases. We went down 107 cases. Last week, we did see an increase. That 593 was an increase of 62 cases. This week, we were at 414 cases, which is a decrease of 179 cases. In our line graph, we see our cases right now at 2,091. We have one more day to add to that, February 28th, because our cases, what I'm reporting is through the 27th. But clearly, we have seen a dramatic decrease in our cases from what we were seeing back in January 3rd. So that is definitely good news for us. Testing. AMR continues to test at Eastfield Mall. We continue to have sites at Putnam, Kennedy on Wednesday, Mason Square on Tuesday. Those sites have not seen a lot of high volume, and so as we committed, we would keep these sites open for 4 weeks, and then we would assess how much foot traffic was there and the real necessity of having them. Again, our goal was to make sure that we were going into the communities and having accessible sites. So again, thank you very much to all AMR and all staff who are participating. Again, we will assess those sites. The mayor and I have put forth to the governor, to the lieutenant governor, to Secretary of Sutters and Commissioner Monica Burrell, our vaccine distribution plan. We have asked for 5 sites: Rebecca Johnson, Harena School, South End Community Center, St. John's Congregational Church, and the Ray Jordan Senior Center. And so we have requested vaccine for those sites. The plan is to do 250 per site of first doses, and then of course another 250 for second dose if we are talking about Pfizer and Moderna. We have received a lot of requests for summer events, and we do know that the governor has relaxed the regulations. And so we know that restaurants can open at full capacity. They still need 6 feet social distancing and 6 persons per table, and individuals can only be in the restaurant for 90 minutes. So the relaxation for businesses also will be raised to 50% for most businesses, and that will exclude employees. Indoor performance venues, concert halls, theaters, and other spaces are allowed to open at 50%, no more than 500 individuals allowed inside. Recreational activities, high contact activities like laser tag, roller skating, trampoline, and obstacle courses are 50%. Private homes continue to be indoor 10 and backyard 25. The stalling numbers that were talked about by Dr. Roos as well as Dr. Kerouac should be of concern to us. We do know that every time, or at least the last 3 declines we had, were meant by increases in cases. So we have seen our cases go down and then a surge happen, and that's why the CDC director has said that we should express her concern about, the CDC's concern actually, about the stalling numbers. So what does that mean for us? It means that it is important that we continue to be vigilant and do the things that we all know we're supposed to do. However, it's also important that we in the city of Springfield understand that we are still in the red category. No one should relax their behavior at this point. This is not the time to celebrate. This is not the time to think that this virus, this pandemic is dissipating, because we don't know that. We have been here before where our numbers have been extremely low, only to see them increase. And so I am once again asking particularly our residents in our city to understand that we are in the throes of this virus still. There's still a lot of community spread. And if we are going to come out of this together, it's going to take all of us working together to make that happen. And so again, there is good news. The governor is opening more venues. He's allowing through the state more activity in businesses as well as recreation and restaurants. But again, remember that we are still in a category where we need to make sure that we are adhering to the public health guidance. As the mayor said, we lost another 7 individuals in our city to COVID, a 73-year-old Hispanic male, an 81-year-old Caucasian female, a 90-year-old Hispanic female, a 72-year-old white female, an 83-year-old Hispanic male, a 41-year-old, 41 years old. I mean, that really just, something about saying the age 41 and having an individual die from COVID is really heart-wrenching. Any loss is heart-wrenching, but when you think 41-year-old white male died from COVID, a 43-year-old Puerto Rican female died from COVID. And so the city of Springfield lost 7 individuals to this virus. VaxForce will be doing their town hall on March 16th, and I am very, very proud of the work that VaxForce is doing. The subcommittees are meeting, and next week I'll say a little bit more about VaxForce. The mayor, as you know, is the convener of VaxForce. I work with the committee as well as Axiom Blue, who is also working with the committee. I just want to take a moment to tell you who is on VaxForce, because what I hope is that on March 16th, Springfield residents, you will join us in listening to these amazing professionals who will take questions and give information. Elsie Sanchez is the chair of our Medical Reserve Corps. Kathleen Zegda, Dr. Kathleen Zegda is Public Health Institute of Western Mass. Dr. Jeffrey Scavron is on the Public Health Council, Brightwood Health Center. Jose Claudio, COO, New North Citizens Council. Dr. Andrew Balder, who is the medical director at Mason Square and Health Services for the Homeless. Thomas Ash, the mayor's chief of staff for the city of Springfield. Ashley Bogle, Esquire. She's the general counsel at Health New England. Damaris Jones is the director of harm reduction services at Tapestry. Dr. Sarah McAdoo, who is the UMass Capstone Director, and Denise Jordan, Executive Director of Springfield Housing Authority. Jeannie Clancy, Public Health Council Nursing Supervisor, Springfield Public Schools. Yemisi Olorotola Coates, Chief Diversity Inclusion Officer at Bay State Health. Dr. Melissa Madison, Department of Pharmacy, Western New England University. Wesley Days, Public Health Council, UMass Springfield. Magdalena Esposa, RN, MSN, MBA, CIC, Infection Control Specialist at Trinity Health of New England, and Christina Hubner-Torres, Vice President of Research and Population Health at Caring Health Center. We could not have assembled a more credible, knowledgeable, caring, community-based group of individuals who understand the city of Springfield and who we are. And so they will be the individuals who will be hosting, along with the mayor, this town hall, and we are excited to present it not only to the city of Springfield, but to the Western region. We believe that there is great information and insight that will come from the town hall. I will say a little bit more about the town hall as we approach it, but I wanted you to know who is on the committee. We continue to do our work around contact tracing, testing, contact tracing, isolation, and quarantine. I want to thank the staff at the Department of Health and Human Services for all that you do. Contact tracing, infection control is not always something to do when we're talking about communicable diseases and contacting people and getting credible information, and you do that every day, and I am so grateful to all the work that you do. Thank you very much for this opportunity, Mayor.
Thank you, Commissioner Colton Harris, and also want to thank you too, I neglected to say earlier on, the senior home delivery of meals continues, and everybody working together, so we're continuing to deliver meals to our seniors in need who are at home. With that, we'll now move to the update from the Springfield Public School System. Superintendent Dan Warwick. Obviously, there's a lot of moving parts to this. We had a school committee meeting, working session last Thursday evening, and prior to that, the other meeting announcing our plans. But Superintendent Warwick will update you on the state edicts that have come across. Springfield Public Schools Superintendent Dan Warwick.
Thank you, Mayor. Morning, everyone. As the mayor said earlier, since school closed down just almost a year ago now, we've provided 6,356,264 meals for our families. And this weekend alone, we provided 88,052 meals. Our attendance rate, as of the end of February, for this year is 92.2%. At this point last year, it was 93%, so we're only 0.8 off last year's attendance rate, which really speaks to the outstanding job the staff and all of our schools have done keeping our kids and working with their families to make sure everyone's engaged. As you know, there was an announcement from the Commissioner of Education in Massachusetts regarding school reopening, and the Commissioner has said, based on student learning time regulations, which he has the authority to enforce, that for pre-K to 5th grade students, they would have to be in school live starting April 5th in order for the time the kids are putting in count towards the time and learning requirements for the state. So if they're not back in April 5th, they'd have to make up that time either on Saturdays or in the summer. So we're working with our school committee to prepare a plan to bring back our pre-K to 5th grade students. We might include 6th grade with that in the middle schools, as well as the groups we always intended to bring back in early, our high-need special education students, our SLIFE ELL students, and our vocational students for the vocational piece only in grades 10 to 12. So that would be our phase 1 reopening, and again for April 5th. Commissioner has said we have to do a phase 2 and phase 3 with middle school and high school, but hasn't announced the dates yet, so we're waiting to hear those dates. Again, all of this is subject to collective bargaining with the unions. On the city side, Patrick Sullivan has just done a fabulous job on our facilities, and we've done, with the support of the mayor, about $1.4 million worth of ventilation work. So our facilities are going to be ready for our kids to return safely. Again, we just will have to complete the collective bargaining piece of this so that our kids can return, and we're working on that. But I really want to thank the mayor for all of his support with technology and the ventilation systems, because we're really been able to keep our kids focused, keep them engaged while they're in remote, but we really feel we can do a great job on a return. Right now, we're in the process of surveying all of our parents, and it looks like right about 50% of the parents want their kids to come back in at this point. It is up to the parents. If the parents choose for a child to stay remote, they can stay remote for the rest of this year. So the parents are going to make a student-by-student decision, and we'll come back. We fully intend to submit a waiver to come back in hybrid, not full reopening. And the commissioner understands that communities like ours that are in remote, the community still in red, it makes sense to bring the kids back in a hybrid reopening so we can keep that 6 foot of distance that we'd like to keep, and then move towards school reopening as it is appropriate. With the support of our health commissioner, we're going to have our fall 2 season. We were able to test our coaches and kids, and that fall 2 season for football and volleyball is going to start today. So we're very, very pleased about that, because the kids really need these outlets. And it's just been a great effort. The commissioner's been great working with our nursing supervisor, our athletic director, and our assistant superintendent, so we can keep our sports programs going. Thank you. Thanks, Mayor.
Thanks. Thank you, Superintendent Warwick. I'll now go to the public safety component of the city update, and I will call up the Fire Commissioner of the City of Springfield, Bernard B.J. Calvi, and again, tremendous job on the combined city dispatch center, state-of-the-art. Commissioner Calvi.
Thank you, Mayor. Good morning, everybody. This week at the Springfield Fire Department, we only have one employee down with COVID, so we're very pleased about that. This is due to the hard work of all the men and women at the Springfield Fire Department and our COVID protocols that we have in place. I'd like to thank all of them for the hard work that they continue to put in every day, day and night, 24 hours a day. So great work by everybody at the fire department. Congratulations for keeping our numbers low. A little safety thing this week, the temperatures are warming up during the day into the 40s. We're getting some rain. If there's any ice left out there, it is definitely not safe to be on. Stay off any ponds that have any ice left on them. There's a high possibility that you will fall through and go into the water. The freezing at night is not enough to refreeze the ice, and it's very dangerous out there. That's all I've got for this week. Thank you very much.
Thank you, Commissioner Calvi. And now from the update, the Springfield Police Department, the Police Commissioner for the City of Springfield, Cheryl Clapper.
Thank you, Mayor. Good morning, everyone. We only have one still out with COVID, still testing positive, so our numbers are good. The murder that happened last week, it's an active investigation. It's ongoing. We are progressing with that investigation, though. Captain Duda and the DB continues to work very diligently on that. Last night, we also had an armed robbery, 590 Boston Road. It's the quick pick. He armed robbery while masked, and they did a great job last night, overnights. They made an arrest on that. Evidence was recovered. The gun used is a pellet/BB gun, so that is in our possession. We did have one shooting over the weekend, left one with a wound to his heel. And so far he's being uncooperative. That was at the 29 St. James Boulevard area. We are testing this afternoon in the booking area one of the new products. As a pilot, it's Custody Protect. It goes on someone who is in custody, a wristband or an ankle band, and it monitors their vital signs and it alerts us if there's an issue. It's in the testing phase. We're seeing if it would fit with the Springfield Police Department. The lobby is open today. It's open for appointments only. We are starting with the license to carry, the new application. So you call the clerk's office at the Springfield Police Department, make an appointment, and we're starting to get those done. We will add on hours, off business hours, maybe even look at a Saturday to get some of these caught up with. Congratulations, as the mayor mentioned, to Officer Ruben Barrero, the first Hispanic officer in Springfield. He'll finish with over 46 years of service to the city, and one of the longest serving officers, and certainly the longest serving Hispanic officer. And I'd also like to congratulate Reverend Amos Bailey and his wife Ruth. It was his 80th birthday. He was a chaplain on call, and they're celebrating 55 years of marriage. So good luck to him and congratulations. Thank you, Mayor.
Thank you, Commissioner. Thank you, Commissioner Clapper. Thank you for mentioning our friend, Reverend Amos Bailey. Always a gentleman, one of the original members of the Community Police Hearing Board that we have. So happy birthday, healthy birthday, and happy 55th wedding anniversary. Double whammy, but in a good way. We'll now move to the Department of Public Works and Director Chris Signoli, and again, it's pothole season, and we want to know where they are so we can fix them. The Director of Springfield Department of Public Works, Chris Signoli.
Mayor, thank you. With regard to the DPW, we have one employee out. Starting this week, there will be utility work that is going to be commencing on some of our Mass DOT projects. Excuse me, Bay and Berkshire, which is under construction. There will be construction activity out there. And Berkshire Cottage and Harvey will also see an uptick of preparation work with regard to utilities. That project will start full construction in April of this year. As the mayor mentioned, this is pothole season. I expect it to be much worse this year than it has been in the past few years, simply because the amount of snow and water that we have on the ground right now. Please, if you see one, call it in the 311 so we can get to it. Common complaint I get is there's a pothole that I drive by every day and nobody ever fixes it. Well, if we don't know it, especially on side streets, we can't fix it. So please get into 311 and we will get them taken care of. That is it with regards to DPW. Thank you, Mayor.
Chris, on that, is that Berkshire Cottage with the traffic light we've lobbied for, is that, or is it the Harvey?
Yes, yeah, Berkshire Cottage and Harvey is an intersection. Berkshire and Cottage does not have a traffic signal. New traffic signal is going to be going in there. There's been a handful of fatal accidents there over the years, so this has been a long time in coming. It's a Mass DOT project, so we are obviously looking forward to get that done. And just as an aside, I'm glad you reminded me, Mayor, St. James Avenue, St. James Boulevard, and Carew Street, the Mass DOT is working on the redo of those double intersections. There is a public hearing this week. It's a virtual public hearing. It will be posted online, and residents have the opportunity to make comments on it. It is posted on the mayor's communication website as well as the DPW's.
Thanks, Chris. Thank you, Director Signoli. Again, we lobbied very hard to Mass DOT and the state officials, and we're very thankful to them finally that we're able to get a traffic light signal at Berkshire Cottage in Harvey. It's been, as Commissioner Clapper and Commissioner Calvi can tell you, for the residents and business community there have been a number of accidents, and people have a tendency to speed or be impatient there. So we're very, very happy after years of requesting that we're going to get that done. Cottage, Berkshire traffic light work, traffic light will be installed there, so that's good. He and his team have done yeoman work, wonderful job. The Director of Facilities and Parks, Director Patrick Sullivan.
Thank you, Mayor Sarno. We have one person out with COVID in the Department of Parks and Facilities. We are completing the setup of the tent for the collector's office. It will be ready as soon as tomorrow. This will reduce 800 visitors into the City Hall complex on a daily basis. This is due to the excise tax bills due next Monday. Our school work is wrapping up. We have finalized and presented our final report to the school committee, and we are just making just final installations over the next week and a half. This weekend, in reviewing CDC guidelines, this story popped up from NPR dated February 25th, and it's titled, "Some Massachusetts Parents Say It's Not Safe to Go Back to School." And in this article, NPR stated they used Dugging as the example, and they've indicated from a parent that nothing has been done in our school buildings. So I just want to reassure the public that we have spent over $1 million in our school buildings at the direction of Mayor Sarno. We have an in-house team that consists of our health commissioner, Helen Carlton-Harris, Superintendent Warwick, his team, my team headed by John Kerrigan and our facilities tradesmen, along with our industrial hygienist, Robert Kirchner. We have gone through every school building. We've installed MERV 13 filters. Where we could not install MERV 13 filters, we've installed the carrier units, and we've gone above and beyond at the mayor's direction and have installed I-Wave systems in our Tier 1 schools. Not required, but the mayor wanted optimal conditions wherever possible. So I want every parent to know we have the proper air systems now in place in our school buildings, and I would ask the press to please report the full story on these, because it's a very scary time for everyone still, and we must let everyone know the full story so they can make an informed decision when they return their children to school. On a positive note, we have also been encouraged by the Commonwealth with reopening, so we are preparing for summer programs, the Carriage House and the Emma's Place reopening, and we'll have more details on those matters next week. And then finally, non-COVID, there are issuing high wind warnings, so there'll probably be some effects on pine trees. So if you do have an issue affecting your house or a city street, feel free to call our forestry department. And as Commissioner Calvi said, The ice is pretty much melted. However, there are patches. They could be tempted to young children to try to jump on those. Please stay off the ice and talk to your children about that. Thank you.
Thank you, Director Sullivan, for clarifying that with NPR, WFCR. I cannot remember the last time they said anything positive about the city of Springfield. All we ask for is fairness, get the facts, get the other side of the story. But they seem to want to look upon, they're down us on their nose at us, and it is very aggravating. That is misinformation, and they should be ashamed of themselves. But again, I ask from NPR and WFCR, fairness, get the facts, and I don't think anybody in my administration can remember the last time anything that they said anything good about the city of Springfield. I'm not sorry to say that either, because that has been put across to them. There's challenges, let us know, we'll deal with it. But get the facts, not one-sided stories and keep taking shots at the city of Springfield. So you're on notice for that. Without further ado, city of Springfield's in the business of doing business. And Tim Sheehan, Chief Development Officer, Tim Sheehan and his team have done a tremendous amount of getting monies, grants, funds, assistance out to our business community, especially our black and brown community. Huge percentage of the grants have gone on to minority business owners. Without further ado, Chief Development Officer Tim Sheehan.
Thank you, Mayor. Early Saturday morning, we saw a positive forward movement with the $1.9 trillion Corona relief package advanced by President Biden. The package generally contains $1,400 payments to income-eligible citizens, ramp up in vaccine distribution, extended unemployment aid through the summer, school reopening assistance, housing and food security funding, small business assistance, state and local lost revenue funding. Commissioner Carlton Harris covered the changes with regards to the reopening plan for the state. The only thing that I would add to that is that we hope that the metrics continue to improve so that on March 22nd, we will be able to advance to step 1 of phase 4, the farthest we've come in this process thus far. And that will certainly allow more businesses that have yet to be able to fully engage to do so. I would also recognize that the state of Massachusetts has contributed $563 million to over 12,320 businesses in the state of Massachusetts. I also wanted to take a moment to just focus in on the economic impact that the virus has had on women. In the past year, more than 5.4 million women have lost jobs, according to a report from the National Women's Law Center. Nearly 2.1 million women have been forced out or have left the national workforce entirely, many due to the heightened encumbrance of childcare, virtual schooling, elder care, and pandemic-related burdens. Of the jobs lost in December, the vast majority of those were held by minority women, according to the federal statistics. Women continue to be the bedrocks of family life, but they also represent a significant portion of our collective economy. Direct relief burden sharing, and flexibility for the most invisible and uncompensated work that women shoulder in the family must be considered in the new relief funding as new relief funding becomes available, especially if women are expected to continue to be important drivers of our local economy post-COVID. The accounting software company FreshBooks recently reported that on average, women-owned businesses are taking 3 times longer to recover from the pandemic's financial blows than businesses owned by men. And nearly 60% of women-owned businesses included in the study said they expected their businesses to take more than 6 months to recover. This is more than just a bunch of numbers. It's real dinner table economics for many families. I have spoken previously about growing our post economy more equitably. This is but one example. In order to grow more small businesses, advance women's careers, and retain women in the workforce, more must be done in providing diverse, responsible child care programming, as well as creating professional opportunities. The Massachusetts Coalition for Early Childhood Education is a great start. This group is a lobbying effort for state and federal policies to change, drive improvements for early childhood education, conduct research around early childhood needs, and more. I'm very happy to see that MassMutual CEO Roger Crandall is one of the coalition's 5 co-chairs. I also wanted to take a moment to recognize MassMutual Life Insurance Company. Last Thursday unveiled a $50 million fund with a plan to invest half the money in Black-owned and managed businesses in Massachusetts, and the other half will be targeted to Massachusetts-based technology and sustainability-focused companies outside of the Metro Boston area. MassMutual is looking to make investments of $250 to $2.5 million in such companies. The fund will consider companies that have demonstrated significant market traction as a startup or have annual recurring revenues of at least $1 million and scalable revenue streams going forward. These 2 noteworthy private sector initiatives indicate an early embrace by the private sector of the need to recast our regional, state, and national economy in a more equitable manner as it emerges from COVID. Springfield will remain committed to this effort as well in its deployment of virus relief and recovery resources moving forward. Thank you.
Thanks, Tim. And once again to NPR, WFCR, General Manager Martin Miller. Springfield's been ahead of the curve and has been noted throughout the state for what we've done for our school systems above and beyond, economic development stepping up first for our businesses, the first with Commissioner Helen Carlton Harris and others to stand up and deal with the homeless population, many that were coming from other areas of Western Massachusetts and taking the bull by the horns. So again, I ask you, get the facts and state the good that happens out of the city of Springfield and stop with these cheap shots. I'm getting sick and tired of it. And so are my people of the city of Springfield, my business community, my cabinet heads and rank and file. City of Springfield's a good, strong city of all creed, colors, and backgrounds. And like many urban centers across America, we face our challenges. But we continue to work hard to conquer those challenges and to offer opportunities to each and every one of our residents in the business community. No one is perfect, but I'm getting sick and tired of these depictions, whether it's from that pompous ass, Tucker Carlson from Fox News, or NPR, WFCR, always looking down upon the city of Springfield. A lot of people make their money off the city of Springfield. And don't forget that. And don't forget that. With that, we received an update pertaining to law, HR, and labor. Financial update has come forward. So at this point in time, we'll take any questions or comments you might have pertaining to my cabinet heads or myself. Paul.
This is a question to Superintendent.
Yes, Superintendent Warwick, please.
Dan, you said you're going to ask for a waiver from the Education Commissioner for the reopening. What are you asking the waiver for?
So the commissioners ordered a full reopening, and our waiver would be for a hybrid reopening. So our kids would come back, but they'd come back part-time, so that the kids would be either in Monday, Tuesday, and every other Wednesday, or Thursday, Friday, and every other Wednesday, so that we can keep the kids 6 feet apart, because the community's still in red. He said he'd recognize those kind of waivers for communities like ours that are in remote right now. The hybrid would be an appropriate transition. So we're going to prepare that waiver and submit it. But our kids will be coming back April 5th, regardless. Pre-K to 5, pre-K to 5 for sure. We'd like to add 6th grade to that. And also the kids we wanted to bring back early from the beginning, our high needs special education students, our ELL SLIFE kids, and our vocational students for their shops for grades 10 to 12 only. So originally, we targeted that population to come back March 15th if we could get everything done on time. We haven't been able to get all the collective bargaining agreements completed. So we're going to have to work and get those done by April 5th.
Last question, pool testing, that's been something that the governor has been
Yep.
pushing. He was on the report on Friday with an event up there. Is that something that Springfield is looking to do?
Yes, we signed up for that, and we're going to be, we're going to have that all ready to go.
Superintendent, just to follow up on that real quick, in terms of the waiver was granted for the hybrid, is that always kind of the plan? 'Cause I know you were thinking about having the younger students come in
Yeah.
roughly around that time
Yeah.
anyway. Was that always the plan?
Yeah, we were always planning to start with hybrid. It makes sense. The commissioner's edict really was trying to go for systems that maybe had come back hybrid some time ago and would be ready for full reopening. But the full reopening for Springfield, the kids would be less than 6 feet apart. And given the fact that the community's still in red, we don't think that's advisable. Commissioner recognized that and actually encouraged some of us to apply for the hybrid waiver.
I know that there was some discussion about like a 3 feet situation, but is that something that you're understanding that is more so for communities that aren't red?
Yeah, I mean, Springfield's one of the few communities that are still in red. There are communities that have already done a full reopening, and they've come back in, and they are operating at 3 feet. We'd like to be able to start with a hybrid at 6 feet, and then as we move forward, the commissioner may order a full reopening for everyone, but our hope, our community by then has dropped down to yellow or something where it would be safer.
One quick follow-up.
Sure.
In terms of the collective bargaining you're dealing with, how many different bargaining units here besides the teachers?
Yeah, we have about 10 or 11 groups. We're presently engaged in negotiations with the 3 major groups, and we'll see what other groups we have to come to an agreement with.
How do you feel about that? Are you confident you're going to get the deal done by time?
Yeah, we're going to have a deal done by April 5th because we have to come back in April 5th. So we're going to work at that, and we're confident we should be able to do that, yes. Thank you.
Thanks, Dan. Any other questions or comments, Paul?
Mayor, I've got a question for
Sure.
you. You alluded to the ongoing discussions with the Department of Justice.
Yes.
Friday was Andrew Loving's last day.
Yes.
Has that affected the talks at all? Is this going to be, on hold until
No,
a
we-
new person is appointed?
No, we've continued those discussions, and Mr. Clapwood and Solicitor Pakula, nearly weekly, we've continued those discussions, and we, was it Wednesday or Thursday? I can't remember, we were on with the DOJ representatives, and, really working on a red line, and where mutual agreements are coming. So, no, I wish U.S. Attorney Andrew Loving the best. We worked well together, and we'll await to see who the Biden administration appoints for U.S. Attorney, but that has not stopped. We have continued to meet continuously to update the DOJ with retired Chief Justice of the State Supreme Court, Roderick Ireland, who I brought on, Judge Ireland, on the initiatives that Commissioner Clapwood has already done, and on the reforms that we're working together to continue the process for the Springfield Police Department, the residents, and the business community of the city of Springfield. So no, we have continuously met.
And you believe this is going to lead to a resolution of this?
Yes, yes, very, very hopeful, and we have continued it going, and Commissioner Clapwood just mentioned a new initiative she's putting forth on the medical bans. I believe we will be the first in the nation doing that, having those medical health bans on there, when the interaction with an officer, he or she, that is able to take their vitals. And something you might not see is that individual going through a mental health situation, that situation, does the individual have a health situation going on? So it'll be another layer of protection for the individual, he or she, that's dealing with the police department, whether it is a rescue call to help out, or they're dealing with a criminal type activity. And again, I don't think I'm wrong. I think we will be the first in the nation to be doing that. But the DOJ conversations and meetings, and I've continued on nearly weekly.
You know, there's been some complaints from some city councilors that they feel like they're left in the dark about what's going on as far as forms go. There was a release that came out from the public information officer of the police department last week saying that the discussions remain confidential.
As DOJ wants them. As DOJ wants them. And again, the chief negotiation goes down with the chief executive of the city of Springfield, which is myself, and the police department and our law department. At the appropriate time, the city council has been updated. There have been executive sessions. Some of those city councilors that are complaining have been invited to a number of community forums that we've had with police relations initiatives and reforms, which anybody and anyone can come on there and say whatever they want, but they decide not to come across. I'd have to say that with new council president Marcus Williams, there's been a very, very good working relationship. We've met numerous times. He's not only met myself, he's met with Commissioner Clapperoux, and he's been updated on situations. But as DOJ wants it, these are negotiations, and they want it kept that way. And at the appropriate time, the council will be given more and more information as we move toward an agreement on it. So we're following the statutes. But again, when counselors, I'm not saying all, and again, Council President Marcus Williams has been wonderful to deal with. When they've been given the opportunity to be involved in meetings, community meetings, only a few have taken advantage of that. The ones that have complained, really, I don't think they've ever come on those meetings. And again, those meetings have all the officials on there, including Judge Ireland. You can say whatever you want. We've had 4 or 5 on it. But again, these are negotiations. These are negotiations with the chief executive officer in the police department and city solicitor of the city of Springfield, as DOJ wants it and has recommended it. And at the appropriate time, we want to get everybody on board. These are very delicate negotiations out of respect to our residents, business community, and to our brave and dedicated officers in blue. Any other questions or comments? Yeah.
You said something about a dirt bike ordinance. When was this introduced? Because I just did a search of these council's agendas. I didn't see anything that was recent on that.
I think there was something there besides the fireworks, something to do on dirt bikes as far as fines or giving more things. It could have been, I think it was in Council or State Representative Orlando Ramos's committee, Commissioner Clapper, am I correct on that? I know on the fireworks ordinance, this could have been a little while ago, but we're looking to put more teeth into that in the fireworks ordinance. And when Councilor Davila met with me not too long ago, he said he would bring it or ask Chairman Orlando Ramos, State Representative Ramos, to bring it out of committee. And again, that's a home rule that puts some teeth in the fireworks. And on the dirt bike ordinance, that also puts some teeth in rearranging of that, so we can work hard to get those. And many of them are stolen, illegal dirt bike, and they're illegal to begin with under Chapter 90. And I've also asked Commissioner Clapper, with our very strong relationship with the state police, to incorporate them. This is a very dangerous activity, not only for the dirt bike riders who could be injured or worse, but for the residents and vehicular traffic who they come right at you, or even with the bicycles, but let's say the illegal dirt bikes. But it makes it very, they'll say, hey, why can't the cops just go out there and chase them and grab them down? They have to be very careful on that too, because then they'll be accused of being too aggressive. Yet in turn, they might end up saving that young person's life and getting an illegally stolen dirt bike off the road and not having a pedestrian and or mainly a vehicular person, he or she, many times who are senior citizens, older. It's very traumatic. So it's just an air of disrespect that is put across from some of these young people. Not all the young people. Sometimes I talk to the kids on the bike, and they're pretty good kids. You'll always have 1 or 2 that want to do more. but there's the cooperation of the council. This is something that, hey, forget about benefiting me or benefiting the police department, benefiting our residents, it would benefit them. So let's get that fireworks home rule legislation out of committee, and let's revisit with this illegal dirt bike strengthening the ordinance, how we can, on a Chapter 90, I believe it was on Chapter 90 rules and regulations. So the ball's in their court.
But Mr. Mayor, my understanding is that the fireworks criminal petition would have died in committee at this point, and that there was some communication between your office and Councilor Davila about the timeline submission, resubmission.
Hey, Matt, listen, I know you carry the water for the council all the time, it's fine, and I have you come in here and you constantly want to take shots at me, and that's your prerogative. Take me out of it. This is good for the residents and the business community, city of Springfield. We put it, it's all spelled out there. Move it forward, let's get it so we can get it to the legislature and get this thing done. It's good. You don't have to agree with me all the time, but it's good as far as putting teeth in to when these things are confiscated or they're arrested, that all of a sudden now they might not be able to get their license. They can't get their registration on it. So it's there, let's get it done. Plain and simple.
But nevertheless, it would have died by this point.
So get it back out again, man. Get it back out. It's something good for the city and the residents. So enough of this thing, well, Sarno put it across. Who cares? It's something good for the residents and the business community. I'm about business, getting things done, not this political BS that goes on. Not with all councilors, but with some. I'm brass tacks now. We've been dealing for nearly a year with this COVID-19. All I ask of you, the media, is fairness and the facts. Fairness and the facts. Whether pro or con. We've done a hell of a job knocking down this COVID-19, but we still have to deal with urban issues. We are giving the vehicle to the city council on how we can deal with these issues. So I'm asking the city council and all, this is good for the city, good for the council, good for the residents, good for the business community, good for our police department. Please move on it. Why the hell did it die in committee? Why did it die in committee? Everybody and their mother was complaining about the barrage and torment of the fireworks going on. Everybody and their mother was complaining about the illegal dirt bikes going on. We try to put something legislatively in home rule petition, strengthen an ordinance on illegal dirt bikes, and it dies in committee. It dies in committee. So the facts are the facts there. I allow you to come in here all the time. All the time. You got thick skin. But we've done some good things here in the city of Springfield, and when there's a situation, we'll deal with it. But fairness. I've already called out other media entity. Fairness. I don't get involved in this petty stuff. Mayors have to react. Mayors have to solve problems yesterday. They can't pontificate on it. People can reach out, feel, and touch a mayor. They get to you. I need help, mayor. Got to help my family, help my mother, help my son, help my grandparent. I need to be fed. I need food. I need clothes on my back. I need help with my bills. I have a problem on my street. Can the police help me out? You want to take shots? I can take shots too, my friend. Any other questions or comments? Yeah.
One quick question for
Sure.
we were talking about the new recruit class. It's sort of a what? Can you explain a little bit? You said that there were, under the circumstances we were in today, having a hard time getting the same number of people to apply for that position. Are you worried about you're not going to get the same number of quality candidates? I mean, the pool will be that much. It's 10% or so that you
absolutely worried about it. It's of grave concern. I've had discussions with the mayor about it, and I think that it's quite obvious that police work is no longer a desired profession. Between reforms, new law changes, new restrictions on the police department, our image being tarnished so much, and it being so dangerous, it's not an easier job to do. It's definitely a more difficult job. Even taking something as small of a problem it might be in the community as dirt bikes, it frustrates the officers to no end. They can solve a lot of these problems, but without the backing of those involved, the mayor's been very good. The city council, not so much. Some other groups, not so much. The environment is not an environment we think that we can go out and explain to you why a dirt bike rider may have been injured. We're not going to get the support. It's going to be, what did the police do? So young people know this. Their parents know this. It's a dangerous, difficult job, and you're constantly under pressure. So as the mayor mentioned, last time I checked, there was 49 applicants for the next police exam, where usually this time we would see 300 to 500. 49, and 14 of those have paid and committed to that exam. So it's very concerning. I think it's going to be something that you got to be careful what you wish for coming about in our future as far as policing goes. Actually, we were speaking the other day with other police chiefs, and there's more law enforcement officers now taking fire exams than ever before. If you're in the same retirement, you're going to see us as a group start to leave this profession and go into something else. Between the dangers, the restrictions, the threat of decertification and losing your job, you're not going to get the qualified applicants. So yes, in answer to your question, it's very concerning.
Thank you, Commissioner. Any other questions or comments? Okay, hearing none. Again, to the media, I want to thank you, that are here, that continue to get the information out to our viewing public, the listening public, and the reading public, to our residents and business community of the city of Springfield. To my cabinet heads, down to rank and file, again, I thank you and your families. You've been fantastic. This has been surreal, what we've all been dealing with, the COVID-19. But you're tested and true, as we have been with other natural and man-made disasters. To the residents of the city of Springfield, I thank you for your patience, your understanding, and your cooperation as we will defeat this COVID-19. The last thing, I know at times I can get emotional. That's because I care and love this city of Springfield. I'm Springfield born, bred, and proud. If something is wrong, we'll fess up to it and we'll deal with it. But I'm not going to allow anybody, whether from afar or near, to continue to knock down the hardworking people of the city of Springfield and our business community and all the challenges we have conquered and faced. I'm sick and tired of the cheap shots. Get the facts straight. That goes from national media to local media. Good health and God bless. Thank you very much.